My name is Dr. Heather Johnson, and this is a screencast on choosing a frame of reference, part of the evaluative process. The purpose of this screencast is to understand the importance of selecting a frame of reference as part of the evaluative process, then to apply what you've learned to select a frame of reference in a case study. When you get a referral and see a client, you get a lot of information from a lot of different people: the client, the doctor, information from other specialists, therapists. There's a lot of data. And part of the evaluative process is to use everything that you know as an occupational therapist to focus on addressing the most important domains for your clients to get the best outcomes. But with all of the information that you get, how do you know what information to look at? How do you know what types of conclusions to make from that information? How do you sift and sort through the information to get to the data of value and make the important decisions for what type of outcome you want to achieve for your client? How do you figure out if you need to collect more data? What kind of data will you need? As you engage in the evaluative process, you're sifting and sorting through information to make decisions. The process of sifting and sorting becomes more demanding as the evaluative process proceeds, and it becomes more necessary to have more specific guided processes. A good OT evaluator will be prioritizing the domains of at least the client, occupations, and activities. But which ones? This is why we have frameworks, models, frames of references, and approaches. The chances of having a successful journey often begin with a really good map. You could use a framework, and there are a few you may have heard of by now, like the International Classification of Functioning Disability in Health, or the ICF. For the occupational therapy profession, we have the Occupational Therapy Practice Framework. The Occupational Therapy Practice Framework is all of the occupational therapy stuff that we're supposed to know. This document describes every type of domain we typically would consider under our scope of practice as occupational therapists. Occupations, client factors, performance skills, performance patterns, contexts, and environments. Okay, but how do I use this map? Where am I on the map? Where are we going on this map? What is the scale of this map? For that, you're going to probably need a telescope, some sort of lens to help you see what you need to see. For that, you'll need a theoretical framework or a model to guide you. When encountering a big, complicated problem, or many problems, it helps to come up with a way to sift and sort through what is the most important information and make decisions on what are the domains of concern you want to address. It's also important to select and decide how to approach addressing such concerns. Occupational therapists can decide upon a number of techniques that we call models, theories, frames of reference, or approaches. They can be used individually or in combination to map our journey and give us a lens in which we look at that route. A theoretical model doesn't necessarily narrow down what you're looking at, but it gives you a way to organize and prioritize. Here is the PEOP being used as a clear theory to organize all of the client's information into 4 major themes: participation, person, occupation, and environment. But being able to see and organize everything a little more clearly isn't going to necessarily help whittle down all that data into the most important priorities. For this, you're going to need a frame of reference or an approach. Let's consider those to be selecting a drawer from a toolbox to help you on your journey. You can call these things the compass or the magic lens or the filter that you add to your telescope. Frames of reference or approaches help us decide which path we want to walk on the map. FORs and approaches help us decide on screens, assessments to do with our clients to gather more information. FORs and approaches can help us to decide upon interventions. You have a really big toolbox, and each drawer is a point of view that you're going to approach the problem. Think of person factors as a way to divide these drawers: biomechanical, sensory, psychosocial, behavioral, medical, cognitive, neurological, developmental, ecological. There are more, but let's say that your client has weakness that is affecting their ability to complete self-care activities. Maybe you will use the biomechanical approach. But what if the cause of the weakness is neurological? What if the person has dementia and won't understand exercises? Maybe you will need a cognitive approach. You need to choose the best match of an approach for your client situation, and this will come with practice. If you choose the wrong approach, you won't be addressing the right issues in the appropriate way. If your client has dementia and weakness and you choose a biological approach, they don't understand the exercises and you aren't helping them very much, unless they had a history of being a bodybuilder and this is a valued role for them. The right FOR or approach will guide you in selecting the right assessments for your client. Evidence-based assessments require the OT to have sufficient facts about the client to support decision making. This week, we are looking into the biomechanical approach and the occupational adaptation approach. The biomechanical approach is used to explain function using anatomical and physiological concepts like we've been covering in this course, such as kinetics, anatomy, kinematics, and exercise science as the theoretical base. What approaches have you learned in other courses? So let's say you decide to use the PEOP model to map your data, then a biomechanical frame of reference or approach. You may conclude that the problem is weak muscles that can be rehabilitated through exercise. You may use biomechanical frame of reference assessments to gather more data for your objectives. Or what if you use an occupational adaptation approach? You'll think that maybe strength can't be rehabilitated, or that for now, the most important thing is for the client to be able to do what they need to do for self-care. So you'll be showing them how to use a bunch of adapted tools or how to conserve energy while doing self-care tasks at home. You would use an occupational adaptation frame of reference or approach to determine appropriate assessments to prioritize your domains of concern and measure outcomes. You may also use this approach to determine the client interventions. You can also use more than one approach to identify domains of concern, but think about the approach you select because that will guide the assessments you decide to use for gathering further data and progress on outcomes. It can also guide you in selecting the types of interventions you want to use. Of course, those assessments should be standardized, be reliable and valid and applicable to what you're intending to measure. You can also use models, theoretical frameworks, or clear theories as approaches too. They're just different kinds of filters. You can use one frame of reference to guide your entire process, or you can change the process and use a different approach at different steps. This is why people debate on what's what, but in general, theories and models are maps or lenses, and frames of references and approaches are tools or filters. Screening is the first time you really decide which theories, frames of references, or approaches are going to guide practice with a client. If screening provides enough information to decide on a theoretical approach, then the OT has a theoretical direction for evaluation and intervention. If you have a clear choice of a theory and frame of reference from the beginning, the process may look like this. If you don't have a clear frame of reference or approach determined, you may want to take a more exploratory type of approach to assessment by selecting an assessment that covers many different domains: psychosocial, cognitive, physical issues, environmental issues, etc. You can decide on the theoretical framework or model for the entire evaluative process: an approach for screening, a different or same approach for assessment, and a different or same approach for treatment. Frame of references and approaches will help the occupational therapist contextualize the interpretation of findings and collect evidence to support their decisions. Also, collect evidence to show that outcomes have been met. Of course, sometimes you will not have the autonomy to select which lens you want to use in your evaluative process, such in your case study coming up this week. Some institutions have requirements that you may have to use certain assessments, and those assessments may be determined by the institution or by third-party payers. You don't have to apply filters in this order to make decisions either. It's only one way. What I've described in this screencast is a reductionist or top-down approach. These are the references used to make this week's screencast. If you have any questions, please contact us.